Urinary tract infections or UTIs are very common. It's a common infection amongst men and women. However, women are more prone to urinary tract infections than men. And this is women across color lines, every race of women, and girls, all ages. And this is because of our anatomy. Women have a shorter urethra than men, so it puts us at greater risk than men. About 50 to 60% of women will get at least one urinary tract infection in their lifetime, and 25% of those women will have a reoccurrence within the first 6 months. However, did you know that cranberries can be your best defense against urinary tract infections? They can. So let's talk about it. Cranberries are a powerhouse when it comes to bladder health. And we just left Thanksgiving. It's cranberry season. We see cranberries all over the place. So I thought this would be a great time to talk to everyone about the power of cranberries and how they are great for your bladder health. Cranberries contain a substance called proanthocyanidins, or PAC for short, because the word is hard, but PAC for short. And what PAC does is it attacks the bacteria, the most common bacteria that sticks against the bladder wall, and it causes it to slide off the bladder wall when you urinate into the toilet. The bacteria literally slides off the bladder wall into the toilet when you urinate, and it comes from cranberries. It's contained in cranberries. However, cranberries are not a treatment for urinary tract infection. It's actually a preventative measure. So if you're high risk for getting UTIs, or if you have a UTI and you're on antibiotics, then cranberry substances, cranberry juice would be great. And I just want to talk to you about some common dosages, or common recommended dosages of cranberries to help prevent urinary tract infections, or help heal urinary tract infections, or help prevent a reoccurrence of urinary tract infections. So let's go. Before you start any new health routine, please, I always want to give this disclaimer. We all have different fingerprints, so what works for me might not work for you. So go to your primary care provider and let them know I want to add cranberry substances to my routine to make sure my bladder health is good, especially if you have other underlying health conditions, or if you're taking medication. It's just recommended. So 250 milliliters, 1 cup or 1.5 cup of unsweetened 100% cranberry juice is recommended for prevention. 36 milligrams of POC inside of the cranberry is recommended in a tablet if you're looking for that. But what's most common, what I see all over the place in the CVS and the pharmacies, is 500 milligrams. So 500 to 1500 milligrams. If you have a urinary tract infection and you're on antibiotics, then 1500 milligrams, that's 3 tabs, is recommended daily to help clear that urinary tract infection out, to help clear that bacteria out of the bladder, out of the urinary tract. And after the urinary tract infection is gone, 500 milligrams a day is recommended to prevent a reoccurrence of urinary tract infection. If you're going to take whole cranberries, eat whole cranberries. What's recommended is 1 cup of whole cranberries, but I don't know too many people who eat cranberries whole because they're very tangy. However, if you're that person, then 1 cup is recommended. Listen, I want to say again, if you are on antibiotics for a UTI, then make sure you talk to your healthcare provider. Let them know that you want to add cranberry supplements to the routine to help clear the bladder out. And you want to continue to take cranberries to help prevent a reoccurrence. This is She the NP with a bit of healthcare information. I hope it was helpful. Have a happy holiday season. Be safe, and peace.